We didn't either. She does have the runny eye thing again. I don't know if it was from her crying.
She urinate on herself? I smell something.
Yeah.
We just watched her yesterday.
Is she able to hold her bladder, or is she having any bladder issues?
Allie's the one to ask for that. I mean, I picked her up last night to clean her up some, and she peed. So.
She pees randomly.
Tell me, start from the beginning.
Okay, so that's it. In the morning, she was doing just fine. She was all hunched up in a ball,
and she was cleaned up last night, too.
You're doing a lot better, baby.
But she was still favoring the left leg this morning.
Mm-hmm.
She's definitely moving a lot better.
Yeah, yesterday she could barely even move her legs at all. And she
didn't jump or anything that you know of, or
no. She does stinkies a ton at night, and she's spazzing when she does them.
See, she's still favoring that leg because the left leg was like sliding out to the side still this morning.
She had any kind of a head tilt or cocked head at all?
Nope.
Nope. Not that I've seen.
No. And
is she still favoring that leg?
She's thumping a lot.
Yeah, that left one.
Like her, she is hunched. I can see.
And cleaned her up last night. Just set her in the sink with some water, and so that didn't help a whole lot as far as cleanup. She was a lot cleaner last night.
She's been eating? Okay.
Yeah, she was eating this morning.
When she was favoring the leg, was she even using it at all, or?
Last night she was barely moving.
Yeah, she tried getting up her hutch and just fell right off and just laid there.
Dr. Helen. And I'd highly recommend for emergency after hours Dr. Don's. Dr. Mike was absolutely fabulous at finding somebody to treat her, and at night was next to impossible. We were about ready to go up to Brandon until somebody told me about him, because I think I'd heard of him, but I've never used him before.
Oh yeah, Dr. Don. If you can get him to come out, now he's got a second Dr. Mike with him, so.
I'm spilling the entire thing. Oh, poor baby.
Did he send you home with any of the Medicam drops, or just the
No.
Just the shot? Give
just
the shot.
A shot.
Okay.
Last time we gave her that.
Running out of it from what he had in his van, but he gave her a shot of it, and that seemed to help immensely as far as getting her through the night.
Okay.
She does twitch a lot.
Does she?
Yeah.
She's a twitchy rabbit.
Especially when you pet her down here. She always twitches. And then she goes around, sometimes will bite you through me.
Yeah, if I start scratching her back there in the morning, she starts hopping in circles.
The crazy little baby. And she can't see me. There's your little eye.
Allie's like this all the time.
Like what?
Allie's like this all the time.
Oh, yeah.
Yeah, she has her own YouTube channel.
Aww.
And so do the dogs. And the fish have their own also. Oh, and the plants do also.
Well, my suggestion would be to start with it's okay to take an X-ray of the spine to see if there's any signs of spondylosis, collapse of the spinal vertebral column, which would be one of the more common causes for hind end. of hind end weakness back there. There's several possibilities, anything from just an injury to an age-related condition where the vertebral bodies will become arthritic and called spondylosis. And then they can also get a parasite that can do this too, which is really difficult to diagnose. So it's a lot of times what I'll do is just treat it empirically if I suspect it, and we'll put them on the medication for it. But the good thing is that she responded, it seems seemingly to Medicam, which would seem to point more towards, less towards parasite, more towards injury or degenerative back disease. So that would be my thought, to probably maintain her on something like that. And maybe a joint supplement of some sort.
I think that's it.
No, that's digestive. That's not joint.
Oh. I do have
there's something called Fetal M that if you could find it online, I would try to get some of that.
Is that for arthritis?
Yeah.
You know what? I think we're using that at the shelter for a couple of our cats.
Can you make it for cats?
What dosage? I can get that.
Could be like a kitten dose. Whatever the,
We'll call her 4 pounds, 4.5 pounds we'll call her.
No school today?
No, she's going, but she knows all of the history of the rabbit and her daily care.
Manatee County's off today.
Yep, they get next Friday that they're off.
Hey, baby.
She's in Sarasota County.
There you go. All right.
Yeah, I need a lateral spine on Thumper.
Okay. I have to go chase Honey Bunny. Okay. Good girl.
Yeah, actually, I was getting ready to probably try Dallas on the fetal arms.
Yeah, that would be a good thing. It's not going to harm her, so.
Do you have access to Dr. Cohn's records from the Sarasota office?
We can call, yeah, sure.
Okay, because I'd like your opinion, too, before I put her on that. They have x-rays of her.
Bye.
And they have an ultrasound of her that shows some of her back also, because we had that dramatic episode earlier this year for Dallas.
Which pet are you talking about?
Dr. Cohen at Southgate.
I know, which pet though?
Dallas.
Oh, Dallas,
yeah,
okay.
It's the old lab.
Oh, do you think the type of pet Pelican also,
Yeah, you can just ask Scott or to get that forwarded up this way.